Hello, everyone. So we're changing our time to 2 p.m. for connecting the dots with Dr. Ashaye. And today I'm going to be talking about high blood pressure. So high blood pressure is very common, and many decisions are made based on blood pressure readings. People are started on medications, they're asked to change their diet, or even asked to go to the emergency room or, forgo surgery based on readings. But there's so many things that can affect blood pressure readings. And to ensure that the reading is accurate, it's worth it to make sure that we're doing what we need to do. And today I'm going to be sharing 5 common mistakes people make when checking their blood pressure and how to avoid them. So you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas. We offer stress-free healthcare with direct access to the doctor so our patients can get the care they need without inconveniences or delay. You can learn more about our services on our website, www.intouchprimarycare.com. And if you have not already, please hit that subscribe button. This helps us get the word out so more people can get this information. Okay, let's get into it. So, mistake number 1. This is a crucial one, and that is neglecting to prepare before taking the blood pressure measurements. So it's important that we make sure that the body is not overly excited or excessively relaxed before the blood pressure is checked. And there are certain things to avoid that we may not really think about before actually checking blood pressure to make sure that it's accurate. So for instance, it's important to make sure that you haven't eaten, exercised, even taken a bath or shower. I just want to be sure. Okay, good. Even taking a bath or shower before 30 minutes before you check your blood pressure. It's important to empty your bladder. And so those are some of the things. So eating, exercising, bath or shower, caffeine, alcohol, smoking, emptying your bladder, those are some things that can affect your blood pressure. And so trying to give at least 30 minutes before, of if you do any of those things before actually checking your blood pressure can be helpful, because they can make your blood pressure either higher or lower depending on what it is. So a lot of people checking it first thing in the morning can be a good time because of that. So, you just woke up, you haven't had any coffee yet, and hopefully you're not drinking alcohol, and you're not, you can get an accurate blood pressure. But if your doctor has recommended that you check it in the evening as well, just be aware of those things that can affect your blood pressure. And you can write a note down next to the reading so that, if you can't avoid any of those things before checking, at least your doctor is aware that those things happened. Okay, and then they can take that into consideration. Mistake number 2, and this one I see all the time, and that's positioning. So improper positioning even occurs in healthcare settings. And this is why, especially if you have borderline blood pressure or high blood pressure, your home blood pressure readings are very helpful. Research has actually shown that they reflect your true blood pressure readings over blood pressure taken in the clinics or other healthcare settings. So your home blood pressure readings are very valuable. So making sure that they're accurate is very important. So in order to make sure you're positioned correctly, remember 3 body parts: your back, your legs, and your arm. Okay? And you can do right or left arm, but make sure your back is fully supported. So resting on the back of the chair. Make sure your feet are planted on the ground, that they're not crossed, and that your arm is positioned at heart level, and typically it's supported by a table or some kind of surface. So pay attention to your back, your feet, and your arm, whichever arm you choose. The difference in blood pressure should not be different between your right and left arm, except you have a condition that causes that. So if there is a big difference between the reading on your right arm and the reading on your left arm, then that's a cause for concern or a cause to talk to your doctor about. Okay, so either arm is fine. Mistake number 3. So the thing to remember is that you're ready, is that you're relaxing right before you check your blood pressure is important. So you're ready, you seated in the right position, you're in a quiet environment, you're not talking, you're not laughing. Now it's important to wait 5 minutes, okay? It's important to wait that 5 minutes before checking that first reading. And then you wait another 2 minutes before checking another reading. The second reading is often lower. You can record both, but not waiting is so common, especially also in healthcare settings where things are often rushed. Of course, unless you go to a practice like ours. But in many healthcare settings, you walk through the door, you sit down, and then checking your blood pressure within, a few minutes. And oftentimes, if it's not rechecked later, that may not be the most accurate blood pressure reading. So when you're checking at home, just make sure that you are waiting about 5 minutes before in a rested position before you actually check and share those readings with your doctor. All right, mistake number 4, confirm you have the right blood pressure cuff size, okay? So the cuff size can really make a difference. If it's too small, your blood pressure readings will be too high or will be inaccurately high. It will look like it's high. If it's too big, the blood pressure will look lower than it really is. And basically, you're making decisions based on this. So having the right blood pressure cuff is really important, the right size. You can look on the machine. It should let you know on the instructions that came with the machine. It should have a range of arm sizes that are appropriate for that particular cuff. Okay, the range could be in inches or centimeters, typically in centimeters. And then you can get a tape measure and measure your upper arm, like about 2 inches above your elbow, and confirm that your arm size fits the recommended range. So if it doesn't, then you may want to talk to your doctor and see, what is your cuff size and which cuff they recommend. Are you a large or an extra large or something like that, and you're using a regular cuff? That's going to make a difference, and the other way around too. So knowing that you're using the right cuff size is very important. And then the last one I'm going to mention today is the last mistake is not checking regularly. So a single blood pressure reading cannot be used to diagnose high blood pressure. And that's because blood pressure naturally fluctuates, right? It's lower when you're sleeping or when you're laying down. It's higher when you're excited or when you're stressed. So checking blood pressure is something that needs to be done consistently to get an accurate picture. We kind of need to see a pattern of what's really happening. And so that's why it's important, especially if you have high blood pressure, if you're on medications, or if you have borderline blood pressure, to confirm that you are checking regularly. And how often you check will vary depending on, your risk factors and your particular situation. But generally, you want to get at least 12 to 14 readings within a week each month. And but again, check with your doctor for specific guidance about how often you need to check. So those are the 5 mistakes that I see commonly with people checking blood pressure. Remember, the home blood pressure is actually a more accurate picture of your true blood pressure reading. And so checking your home blood pressure is important. We talked about remembering to prepare your body so it's in the right state, not overly relaxed, not overly excited. Remember the positioning, your back, your feet, and your arm should be in the right position. Remember to wait after you're in position, wait 5 minutes before you get that reading. Remember to make sure that the cuff size you're using is the right one. And remember to check regularly based on recommendations from your doctor. So that's what I have today. If you're in the Houston area and you're looking for a doctor who is proactive about your health, we're here for you at In Touch Primary Care. You can learn more about our services and how we can help. You can visit our website, www.intouchprimarycare.com, or call us at 280-9985. And we look forward to helping you on your journey to better health. We make so many decisions based on the blood pressure readings. We make decisions to treat with medication. We make decisions to treat or not to treat other conditions or even to do surgery. We make decisions on whether or not to go to the emergency room, decisions to eat or avoid certain foods. So it's really important to have accurate readings to make sure that the decisions we're making are based on accurate data. And when you take that time to get accurate results and measurements, the best course of treatment is much easier to determine, so we can prevent serious health conditions in the long run and in the long run, and you can feel better. So if you know anyone that would benefit from this, please share this episode with them. And until then, I will see you next week, actually at 2 o'clock. 2 o'clock next week.